Hi guys, I'm gonna talk about preparing for pregnancy. This is the first step if you are planning to have a baby. It's a good idea to start thinking about your health and lifestyle as soon as you want to start trying, or even better, or a couple of months before you stop using contraception. There may be medical issues you haven't thought about yet, such as whether you're up to date with your vaccinations, so it's worth going to your doctor for checkup. Uh, when to use the contraception. With some methods of contraception, such as the male and female condom, such as the female and the male condoms, the cup Geography and natural family planning, you can start trying to get pregnant as soon as you stop using the construction. With other methods such as the pills and the contraceptive injections, it can take some time for your cycle to return to normal after stopping the construction. You may therefore want to come off the pill a couple of months before you wish to start trying for a baby. This is the best way to have a good nutrition when you are pregnant. It's a very good idea to think well ahead when it comes to healthy eating. If you are eating well before you get pregnant, you will have all the right nutrition to support your baby from the day of conception onwards. This means eating regular balanced meals, lots of fresh fruits and vegetables, and cutting down on fast food and processed food. You should make sure your diet includes carbohydrates such as pasta, rice, and cereals are better than processed carbohydrates like white bread, cakes, and biscuits. Fruit and vegetables. Try to eat 5 portion proteins a day, bearing in mind that the more colorful the fruit or vegetables, the more nutrition it is. Protein, you can get the protein you need from meat, fish, eggs, pulses, and beans. Milk, milk and milk products. Fat, try to get your fat intake from vegetable source, such as olive oil or olive fish like salmon, herring, or mackerel. Vitamins and supplements. Okay. The UCDA recommends taking folic acid supplements 400 a day from when starting to get pregnant and throughout the first 12 weeks of pregnancy. Taking the folic acid supplements helps in the healthy development your baby's spinal cord. It's also a good idea to make sure you're getting plenty of vitamins when you are pregnant. Vitamin supplements should, however, be taken to complement a healthy diet, not to replace it. Fitness, weight control, and nutrition during pregnancy. Exercise and weight. It makes sense for you to fat before you get pregnant, because pregnancy and looking after a new baby puts lots of strain on your body. You are fat before you get pregnant, it will be easier for you to keep active when you are pregnant. Exercise can also improving your mood and energy levels, not to mention reducing stress, which is a good thing when it comes to conceiving. If you are underweight, you may need to put on some weight because nature is notoriously unwilling to let women who are too thin get pregnant. Being overweight can also get in the way of a successful pregnancy. So the best thing is to try and achieve as idle as a weight as possible before trying to get pregnant. Okay, this is the the bad things that you wouldn't use it when you are pregnancy: the caffeine, cigarettes, illegal drugs, and alcohol. It's best to avoid all these substances while you are trying to get pregnant and throughout your pregnancy. If you smoke, then giving up will improve. Giving up will improve your chance of having a happy pregnancy and a healthy baby. You can avoid second-hand smoke by encouraging your partner to give up too. If you avoid excessive alcohol consumption in pregnancy, you are also more likely to have a healthy child. It's also important that your partner cuts down on this substance and ideally stops taking them altogether. While you are trying to get pregnant, cigarettes, illegal drugs, and alcohol all have an adverse effect on the quality of sperm. Thank you. Any question? Any question?
Questions?